Hello, everyone. Just to let you know, we'll start in just a couple minutes. Well, good morning, everyone. We hope everybody was able to get on okay. And thank you for joining us for Strengthening Collaborative Efforts for Improved Student Mental Health, Effective School Division and CSB Partnerships. My name is Joe Worf, and I'm the Associate Director in the Office of Student Services at the Virginia Department of Education. And typically, when I introduce myself, I also introduce the director in the Office of Student Services, Maribel Simray. But however, we're honored to have Maribel. She'll be doing a piece of this in just a minute, so I'll let her bring greetings. But I also want to bring greetings from the Assistant Superintendent in the Department of Special Education and Student Services, Dr. Samantha Hollins, as well as Dr. James Lane, who is a Superintendent of Public Instruction, both of whom know about today's webinar and are very excited about the number of participants that we have on this, a very much needed effort on both the parts of DBH and DBHDS and VDOE. Also from the Virginia Department of Education, I'd like to thank Martha Montgomery. She has been part of this from the beginning in the planning, as well as Sarah Bazemore, who's assisting today. Also want to thank our partners with DBHDS and the partnership that we have. It's a great partnership. We hope to continue into the future. Nina Marino and Keith Cartwright will be presenting in just a minute, but I also wanted to thank Catherine Hunter. And Catherine is the Child and Adolescent Program Specialist in the Office of Child and Family Services with DBHDS. And thank you, DBHDS, thank you all for joining us. And we have a pretty packed agenda today, as you see on your screen right now. We're going to start kind of broadly with state agency efforts with DBHDS and VDOE. I'm talking about our roles really and how we work with CSBs and LEAs in the Commonwealth. The DBHDS will start with the role of DBHDS in supporting mental health efforts with CSBs. We have, again, Nina Marino, who's a director in the Office of Child and Family Services, and Keith Cartwright, who's a behavioral health wellness consultant in the Office of Behavioral Health Wellness. As I mentioned before, Maribel Simray, who's the director of the Office of Student Services with VDOE, will give a short presentation on school-based behavioral health needs during COVID-19. Then we will get to kind of the division and community efforts and the LEAs and CSBs and the great partnerships that we have, two of the great partnerships we have in the Commonwealth. We're delighted to have Montgomery County Public Schools and their partner New River Valley Community Services Board with us today. They will be talking about their partnership. Judy Diggs is the Director of Equity and Diversity with Montgomery County Public Schools, and Chris Taylor is the Rehabilitative Service Manager at the Clinical Services line with the New River Valley Community Services. Our second partnership presentation is Newport News City Public Schools with their partner Hampton-Newport News Community Services Board. Linda Askew is the Supervisor of Student Support, and Erica Daniel is the Student Advancement Coordinator with Newport News Public Schools. And we have Great to have Lisa Hogg here, who is the Director of the Youth and Family Services with the Hampton-Newport News Community Services Board. Because we don't have the opportunity to do a chat today and get your questions via chat or question and answer, we have compiled some questions as a team, as a planning team. We have some questions that we have, and we will do what we're calling kind of a partnership panel after our partnership presentations. And we have some questions that we hope would kind of be the questions that you would ask. And so we have those questions ready, and we'll do that with our presenters. And then we're going to have next steps for considerations and planning. So a slide, please. So how did we get here? So some of you may have participated and actually attended the town hall that DBHDS facilitated back on July 27th of 2020, Mental Health Services in Schools. The Virginia Department of Education was invited to the Mental Health Services in Schools town hall. Maribel Simray gave a session during that time, and it was the feedback and really some collaboration after that that brings us here today. We felt the need to really expand some of this information. During that town hall, there was information on kind of an overview as today of CSB partnerships with schools, of school-based behavioral health needs during COVID-19. We talked about prevention school-based services, and then did some brainstorming on supporting youth returning to school. And this is what it's about, our youth. It's about our children in schools. I don't need to tell you that we are in challenging and uncertain times. I know that's been said a few times the last 6 months, but this uncertainty certainly reflects in our students and us, to be quite honest with you. And the uncertainty is on many different levels, right? So we've got uncertainty around the fact that we've got a presidential election in a few weeks. We've got uncertainty that there are protests and some continued civil unrest in some of our communities where our students reside. And we have a pandemic, right? And so in the midst of all of this confusion and uncertainty, we are bringing students back into the classroom, trying to ascertain the needs that they have and delivering the proper interventions to those students. And it's critical now more than ever that we think creatively, that we think together, that we work together, and we bring all pieces of the puzzle together to assist these students. Yes, there are challenges, many challenges, but you know what? There's also many opportunities. And that's kind of like, I would like to build that foundation today of having optimism and opportunity around looking and seeing what other people are doing in the Commonwealth, how this is working, and being able to adapt that to the communities in which you reside. And so without further ado, I will move into, again, so glad to have, slide please. So glad to have Nina Marino, Keith Cartwright, and the partnership for DBHDS. Thank you for this partnership, Nina and Keith, as well as continued partnership in the future. And I'll hand it over to you.
All right. Good morning, everyone. We appreciate being here. We're just going to take a couple minutes because I definitely think we are not the main event today, and probably why folks are on this call. I did just want to say, I think just the sheer number of folks who signed up for this have really maybe surprised us, maybe shouldn't surprise us, but I think it just speaks to the incredible need to have more collaborations and discussions right now around how we can support our kids in schools. As we know, this is a very challenging time. And so I know it keeps me up at night sometimes, and I'm sure it does most of you guys as well, as we are just navigating some really challenging times. So appreciate everyone being here. I'm gonna just do a brief overview of DBHDS for those that aren't maybe as familiar with us, and a little bit about our office, and then turn it over to my colleague Keith. So you can go to the next slide, please. So just a little bit about us. I think folks probably know, somewhat what DBHDS does, but we are established in the Code of Virginia as the state authority for Virginia's public behavioral health and developmental services system. We do operate 13 facilities. All of those but one are for adults. The one child psychiatric facility that we operate is the Commonwealth Center for Children and Adolescents. We do have a direct operational relationship with those facilities, and then we focus on our partnership with our CSBs, our Community Service Board. So in terms of central office, what our focus is to support and improve Virginia's system of quality treatment, prevention services, supports for individuals and families who are affected by mental health, substance use, or developmental disabilities. And our goal is to promote a culture of recovery, self-determination, and wellness in all aspects of lives for individuals in the Commonwealth. So what does that mean? One of the things that we focus on are these types of strategic partnerships with other state agencies, with our local community service boards, as well as with our state facilities to work collaboratively on many of the issues around behavioral health that impact a lot of Virginians. We also provide licensing authority across the state, so folks might be familiar with that. We license most of the behavioral health services in Virginia, and then we also have a role with protecting human rights of individuals who are receiving either behavioral health or developmental services. In most cases, at central office and at DBHDS, we do not provide direct services. We are more of a policy and kind of oversight entity as opposed to providing any direct services. The next slide, please. Just a little bit more about our particular office. So we reside in the community behavioral health area of DBHDS, which is separate from developmental services and is separate from our facility services. Our office didn't formally come into existence until about 2004, where we were able to kind of have our own independent office. Our main goals and priorities are to focus on improving quality and access and accessibility to a comprehensive, coordinated array of behavioral health services for children, which is no small task in Virginia because, as most of you know, behavioral health cuts across many different areas and it does not reside in any one particular place, right? So we have Department of Social Services, we have DMAS, we have Office of Children's Services, we have DOE, who all have a role in children's behavioral health, right? So part of our goal is to be coordinating with all of these other entities around having the appropriate array of community-based services in Virginia. And so with that comes our focus and emphasis on a system of care model and making sure that children and families are front and center, and making sure that we are providing opportunities for education and peer support for children and families throughout the process. I want to touch just briefly on some of the funding and policy oversight that our office has. So we do have a direct link with the federal agency around some of our funding, discretionary grants through SAMHSA or block grant dollars that are specifically allocated to children's services. The funding that comes through our office, by and large, goes out to the CSBs, who are the administrator of the services. And then we provide guidance, technical assistance, and oversight of those funds and how those funds are spent. So we have a mental health and juvenile detentions funding that we oversee, mental health initiative funding, which is a collaboration with the local CSAs and the Office of Children's Services to serve a kind of a unique population of kids. We have child psychiatry and crisis funding that is oversight through our office that was able to bring 3 children's specific crisis stabilization units to the Commonwealth, was able to start mobile crisis services for kids, and was able to pretty greatly expand the access to child psychiatry, which we know is a big need in Virginia, through the CSBs. And then a more recent program we have been working with our vendor to implement is called the Virginia Mental Health Access Program. This is a program that will strengthen the role of pediatricians to also be providing support to behavioral health needs, as that's where kids typically go first and where families take their kids first. And so we see them as kind of our front line. So that program is aimed at helping them with education and also consultation with a child and adolescent psychiatrist. That solves a very unique, not unique, but a very real challenge in Virginia around not having enough child and adolescent psychiatrists and not having enough behavioral health workforce, really. And then the final thing I wanted to mention is we also operate out of our office, our early intervention in Part C program. That's Part C of the IDEA Act. And so we are the state authority for the federal and state funds for that, and that is birth to age 3 for children that are not developing as expected. Next slide, please. For those of you that are interested, I know every state agency has their own maps and their own regions, and none of these ever seem to align. But these are our 5 health planning regions with our community service board. So this is the way we have our maps kind of chunked out in Virginia, and the corresponding regions with our CSBs. Can move to the next slide, please. So the last thing I wanted to just kind of touch on is our relationship with the community service boards. You're going to be hearing from them later today. They were established in the Code of Virginia as the entity that would be the direct service or single point of entry into the public behavioral health and developmental services system in Virginia. They are independently operated from DBHDS, unlike our relationship with the state hospitals. So it is different. Lots of folks are familiar with this in Virginia, but we are a locally administered program with some state oversight. So I think that's important to understand in terms of our role. CSBs can serve either a single jurisdiction, a single city, or they might serve multiple jurisdictions. So they're either administrative, they might be tied to their city government, or they can be a standalone entity. They provide direct services to the community in their area. Some CSBs have relationships with private providers, and some do not, and they provide all of the services out of their CSB directly. It is important to note that CSBs are responsible for discharge planning for individuals leaving state facilities. So that is a unique relationship the CSBs have to our state hospitals. I don't think a lot of folks know this, so I just want to mention this, but in terms of what the CSBs are actually required to do in the Code of Virginia, and when they were established, was to provide emergency services. So psychiatric evaluations, immediate kind of crisis stabilization and services and assessment to determine if an individual needs inpatient care. So that was really what the primary goal of what the CSBs were established to do. And then case management when available, when funding available. So I don't think a lot of folks know that. And we hear a lot about, especially on the children's services side, about variations across CSBs in programming. And that is because, in terms of what's required, children's services was never specifically carved out into the code. It's still not specifically stated in the code that the CSBs will provide those services. Having said that, most of our CSBs are doing far above what was asked of them in the code, and most CSBs across the state are providing children's services, but that does vary quite a bit from CSB to CSB. And that has to do with, individual decisions of that CSB in terms of maybe what the locality needs. It has to do with funding. Lots of different factors go into that. So I just wanted to mention that. We do have under STEP Virginia, which is our big behavioral health initiative, an attempt to actually add in 9 additional core services that every CSB across the state will provide, such as outpatient, case management, same day access. Folks are probably familiar with that one. Those are all part of STEP Virginia and will be, increasing the consistency of services across the state. So, and that includes children's services as well. So with that, I'm going to actually turn it over to my colleague, Keith, who has a much more exciting bit of information. His office, Behavioral Health Wellness, is where all the fun stuff happens. So I'm going to turn it over to you, Keith.
All right. We can go to, I think we have a slide in there. Yeah. So I'm representing the Office of Behavioral Health Wellness, and our office partners almost exclusively with the community service boards that Nina just referenced on suicide prevention, youth mental health first aid, substance abuse prevention, and adverse childhood experiences. So I could spend all day talking about all of that, but in the interest of being brief, I'm going to focus on one of those areas today that I think is really pertinent to this time, and I think it's really pertinent all the time, and that's adverse childhood experiences. So research and then our work and partnerships with the communities will tell us that if we ever want to be really good at suicide prevention, promoting mental health wellness with our students and preventing substance abuse, we're not going to do that unless we get really good at preventing and bringing resilience to adverse childhood experiences. So one of our big initiatives over the last few years has to bring groups of trainers and presenters around adverse childhood experiences. Two, we started with cohorts representing all of our community service boards throughout the state. We've grown that work now to partner with our trauma-informed community networks, who also have these trainers and presenters now. And so what that means now is we have about 225 presenters around the state who go out and talk about the impacts of adverse childhood experiences. I don't think that it's a coincidence in these challenging times as it relates to our schools that this summer we have literally trained and presented to thousands of educators around the state online. And it's one of those silver linings of this challenging pandemic is we never would have been able to reach the numbers of educators that we have if we hadn't been in this position, utilized, I see almost 400 people attending this conversation right now. In person, we were lucky to talk to 30 or 40 people at a time. So, the most of our work right now, or at least mine, is around helping people understand the connection between adverse childhood experiences and future health impacts, future impacts on a student's capacity to learn. I know Chris Taylor is going to be on here soon, following us from New River Valley Community Service Board. They're a great example of how this ideally works for us. We have presenters and trainers in New River Valley. They've done a great job partnering with their community coalitions and their schools. And that's our hope, that through these relationships, through these networks around the state, that we'll ultimately have everybody understanding the importance of addressing adverse childhood experiences, looking at times like this and understanding these challenges are either traumatizing students or re-traumatizing them as they try to come back into the school setting. And that should make us all much more aware of how important it is to have systems in place in our communities that help promote the best in our families and the best chances for our kids to grow up free of this trauma, and then also bringing to awareness the importance of us addressing it as quickly as we can once they've experienced it. So like I said, I could talk all day about this, but I know we're on a tight time. So I'm going to turn it over back to Nina or wherever it goes from here.
Yeah, I'll take it. Thanks, Keith. Nina, do you have anything else or no? Okay. Thanks, Keith, so much, and Nina for the presentation. Such important stuff, and definitely thank you for the partnership. Again, our partnership is so important as we model that for those folks at CSBs and LEAs down at the division levels. Nina, you mentioned and you talked about the regions. I think you're so right about that. Everybody's regions are different, and maybe we can work on that on a different project, because Chev and higher ed and workforce all have different regions. So we need to get that together. But thank you again for your presentation. And we'll go to Maribel Simray now, who is the director in the Office of Student Services. She'll be talking about mental health needs in schools during the COVID-19 pandemic. And I just want to thank Maribel for her work. She's doing awesome, not just because I'm the associate director, but because she really is doing great work. And there's so many great things coming out of this office. And if you didn't know, the Office of Student Services has those specialists around kind of instructional support personnel, right? So school psychology specialists, school social work, school counseling, school nursing, as well as we have the middle. So anything that revolves around the mental health needs of students and supporting those teachers in the classroom. So Maribel, thank you for joining us today, and I'll turn it over to you.
Great. Thank you, Joe, so much for having me here. Good morning, everybody. I am pleased to be with you this morning. And as Joe indicated, I'm I am the director of the Office of Student Services. I am very, very thankful to be part of the amazing team that is Student Services. And we have been very busy over the last few months, making sure that we hear what the needs are from our local partners and work with our other state partners and you all to put together resources to help address some of those needs. What I'm going to focus on this morning, and again, I'm not going to spend an awful lot of time on this, but I will be sharing with you some of the priorities that were identified as it relates to addressing mental health needs as a result of the COVID-19 pandemic and the related effects on education, from school closures back in the spring to a very different way of learning this fall. We know that the impact of COVID-19 is being felt by our students, families, and school staff fairly universally. So next slide, please. The priorities that I am going to be talking about were not identified by the department. I certainly do not want to take credit for that. It was in fact, I think, I can credit the Student and Staff Wellness Subcommittee of our Return to School Task Force. This Return to School Task Force was convened by VDOE. Gosh, I want to say it was probably around April or May timeframe as we were preparing and planning for return to school. And we had a committee that was comprised of several members of from around Virginia, different roles within schools and partners and families, community organizations. And one of the subcommittees, the Student and Staff Wellness Subcommittee, was specifically focused on thinking about wellness in general and behavioral health. And they came up with some recommendations and identified some priorities. You will find their recommendations and more information about that on our Recover, Redesign, Restart guidance. And that is the picture that you see up on the screen. I also have a link to it. I'm not sure if we are sharing the PowerPoint or not, but there are links to these resources on the PowerPoint. I see Joe nodding his head, so that means that we'll be emailing you these resources as well. The Recover, Redesign, Restart guidance is actually not just informed by the Return to School Task Force. It was informed by multiple task forces, so it's a very comprehensive set of guidance. It is not intended to be read from cover to cover. It is really intended to be used on the sections that you are interested in and that you are working on. So I would certainly recommend for those of you on this meeting in particular to look at the Student and Staff Wellness section of the guidance, because it does have a lot of information that I will be kind of giving a little bit of an overview about today. Next slide, please. The first area, as we mentioned, we know that the effects have been pretty universal. So it's really imperative that schools work on addressing the social emotional needs of all students. And by that, this involves providing support and intervention services, not just for students who had demonstrated higher levels of concerns, but this really means that we need to think about everybody, all students in the building, and what do they need. Our wellness subcommittee had a couple of recommendations for priority areas that they identified within student wellness. The first one is really looking at having a dedicated time in the school schedule where you can address social emotional learning. And that is something that I know several school divisions have adopted. Some that are doing hybrid learning and only have a couple of days that maybe going into the school have identified parts of those days, or some of the at home or virtual learning days to really be dedicated to having social emotional learning curriculum as part of that. So that is something that we, or this committee recommended, is ensure that sometime during the school week, we are having dedicated time that is addressing social emotional learning for all students, not just the ones that have the higher level of need. Along the lines of, and we all know, I know we have school partners as well as community partners in this call. But most schools have school-based mental health providers, or school counselors, school psychologists, school social workers that are trained to provide behavioral health or mental health supports to students, but are not solely dedicated to providing those supports. So another recommendation was to really look at the scope of roles and responsibilities that are assigned to these providers, to really try to ease as much as possibly can be done their administrative duties. Many of these folks, in addition to providing direct services to students, may have to do some case management, may have to proctor for tests, or have other administrative duties that not necessarily are around direct services. So looking at what can be eased so that there is more time available for direct service is another recommendation. Next slide, please. In order to be able to provide supports to our students, we know that we need to provide enhanced training for all of our school staff in the area of mental health. And we particularly mentioned the need to really think about trauma and trauma-informed strategies when training our school personnel. And this just piggybacks on what Keith was talking about a little bit earlier, and what he spent most of the summer doing is really ensuring that educators, all of our teachers, are trained on trauma-informed strategies, understand those adverse childhood events, and know what are some classroom-based strategies so that their classroom can be trauma-informed. We most recently have been really thinking hard about what this looks like in a virtual environment. I know that is something that a lot of educators are asking for, so we're actively working on trying to put out resources on that as well. And then the final recommendation related to student wellness has to do with leveraging and using teams that most schools already have in place, but basically intervention teams, so that we can ensure that there's different levels of supports and services that are available for students, and that there's a multidisciplinary team that is looking at and tracking their progress, monitoring the continuum of services, ensuring that there's fidelity of implementation, so that if additional assistance is needed for our students, they don't fall through the cracks. So leveraging those existing structures that school already have to really focus on that social emotional need. Next slide, please. Other than, I think it's a given, everybody is really worried and really focused on our wellness of our students. I think we are also want to ensure that we prioritize the wellness of our staff. It really goes without saying, and for those of you that are in schools, teachers are stressed. They are, they're experiencing a work environment like they never have before. There had been a lot of uncertainty. I think we are fortunate, I think in Virginia, that, we got some time to plan with our early announcement from the governor on closures, and kind of knowing, we were one of the states to put to close first, and then we were one of the states to put out return to school guidance. And, I've heard of in other states that we have, teachers not knowing the day before coming back to school what the plans were. One of our recommendations around staff wellness is that clear communication regarding plans and allowable flexibilities. Like the mental health system, as you know, the educational system is very locally driven. So each locality is making the return to school plans. And we have some of our localities that are fully virtual. We have many of them that are hybrid, or some that are transitioning from fully virtual to hybrid. But those plans are determined at the local level. What we do recommend, although, at the state level, we don't tell them, how to do it, or what they need to do, but we do ask to please ensure that they communicate those plans and allow for flexibility to address personal health and safety issues for teachers. Having that clear communication up front and giving as much warning as possible is really going to help ease some of the increased anxiety that we are seeing with our school personnel. We also recommend that there is access to mental health resources. I know that many localities have employee assistance programs, but we do expect those to become easily overwhelmed, or people may not be aware that they're out there. So ensuring that it's very clear that there's resources available, partnering with other providers to ensure there's easy access, and not to forget about their staff members that are providing those mental health supports, our counselors, our social workers, our psychologists. Just because they are mental health providers doesn't mean that they don't need the mental health support. If anything, they are the ones that are bearing pretty heavy responsibilities at this time, and that can really take a toll. So ensure that we're keeping an eye on our support staff to ensure that we can support them as well. And again, training, I think training is kind of the word of the day for what staff is needed, and don't want to overwhelm school personnel, but want to make sure that they have access to what they need, not just to prepare them to provide services to students, but really how to implement their own self-care strategies, how to continue to build relationships with each other and with students in this very different environment, and how to identify concerns that they see with their students and colleagues, again, in this very different work environment that we have with this pandemic. Next slide, please. And finally, the last set of recommendations was really focused on family and community partnerships. We know that this in particular is, this is always important, but during this pandemic, it is truly critical that we focused on authentic family engagement and on really strengthening our partnerships with our community providers and other services that are available. This is a time for us to really wrap around our students and their families, and that takes really intentional relationships. So focusing on that. I know that right now schools have so much on their plate, but this is truly a critical priority if we are going to focus on the wellness of our students and their families. Next slide, please. And finally, I wanted to share with you some of our related resources that we have available. And we have worked on these over the last several months. The first one that I have listed here is our social emotional wellness quick guides. And gosh, at this point, I think we have 6 or 7 or those. They are geared. These are 2-page, I don't want to call them infographics, but they're short and they're concise with good information. And the nice thing about them is that they have links to a number of additional resources. So they provide a summary of specific recommendations for a population, and then it provides a number of additional resources to address the needs. So for the quick guides, I think we have one that addresses military families. We have one for early learners, one for English language learners, one for marginalized populations. We have one for parents and caregivers, and that one is also available in Spanish. And one for students with disabilities. And I don't know if I'm missing any. I know the one that's coming up, and it's currently in the editing process, and hopefully will be available in the next couple of weeks, is one that is really focused on self-care for teacher and staff. So those are posted on the VDOE website in our prevention section, and the PowerPoint has a link to those as well. And those are already accessible, so school divisions they're PDF accessible, so you can post them on your website, you can distribute them as newsletters for your families as well. We also have, and we started this, gosh, right around maybe June or so, maybe a little bit earlier, our student services newsletter. And we have, that is issued monthly, and those newsletters have a number of resources, not just from the DOE, but this is a time where we really leverage our partnerships that we have with other state agencies like DBHDS, but also our Department of Criminal Justice Services, because they put out also a lot of training related to school safety and supportive schools, as well as the Department of Health And so we let you know of upcoming trainings or webinars. So this is our subscriber list has increased. We have over 3,000 subscribers to that monthly newsletter already. So if you are not subscribed already, please feel free to do so. There's a subscribe button right on the PowerPoint. We also had a mental health in schools webinar series that ran from September through October. Those are posted on YouTube, and actually the last one was this week. So it was a weekly series. We had a webinar that went out once a week. I do have a link to where you can find them, but coming soon, and this is probably the more exciting part, coming soon, we will have a student services professional learning portal. We are expecting that to go live October 19th. So very, very soon, we will have all those webinars posted there, but that will be one-stop shop for all of our resources. I do know, and already saw a couple of comments, the DOE website can be a little bit tricky to navigate. And sometimes it's hard to find things all in one place. We recognize that resources related to mental health are really critical, and we have right now linked in a number of different places to try to maximize the ease of finding them, but we are developing a single page that will house all of resources for a student support personnel. So our counselors, our social workers, our psychologists, and obviously our community partners that provide behavioral health services can access that as well, but it'll be on a single page, and that will be distributed. The link to that will be on the DOE webpage, but that will also be distributed via our newsletter. And then similar to our mental health in schools series, we have a planned video series for November, and that is on self-care strategies. So really excited about that as well. Those are going to be really short because we are hoping there are things that you can do during a staff meeting, or you can provide, it's something you can use at the very beginning of a meeting or at the very beginning of a day. It's just a few minutes long, but it does give you some self-care strategies and tips that you can use that we know is much needed. So that is what we have been up to, and that is the end of my presentation. I know you are all excited to hear from our localities, and I'm going to pass it back to Joe.
Thanks, Maribel. Appreciate it. Thanks, Nina and Keith as well. Kind of for the broad overview of DBHDS and VDOE. And I won't take much time. I know we need to dive right into the wonderful partnerships that are going on in the Commonwealth. So very happy to have Montgomery County Public Schools here with partner New River Valley Community Services Board. Slide, please. And so Montgomery County and New River Valley will be speaking a little bit about how their partnership started, how it's come and how it's progressed. And so slide, please, and we'll turn it over to Judy and Chris. Again, thank you so much for being here and presenting today.
Thanks so much, Joe. And just on behalf of Judy and I and Montgomery County Schools within our BCS, we'd like to say thanks to the DOE and thanks to DBHDS for having us here. I'm going to kind of take the reins on our here.
Chris, you're kind of not coming in very clearly.
Hear me now, Joe?
I can hear you now. Oh. Can't hear you. Sorry, Chris, not able to hear you.
Are you able to hear me better?
Now I can hear you.
Okay, I'll try again, and just stop me if I get lost again. All right, so as I was saying.
I don't know what they said.
No, I can't hear you, Chris. Sorry. Judy, I'm not sure if you are on. Or...
I am on.
Okay. If you're able to
Okay. I'm going to
take it. I'm sorry.
Try to take over. Can you hear me?
I can hear you. Thank you.
All right. So this partnership got started around 2006. And it really got started out of the tragedy, the unfortunate tragedy at the Virginia Tech. And so after that event, there were increased hospitalizations. In fact, you can move to the next slide. Thank you. These increased hospitalizations led to attempting to identify our students before they were in crisis. It was interesting for me to hear that that really was kind of the overall reason for starting the CSBs in the state in the first place. And so when we got started, there were 3 NRVCS employees that were based in some of our Montgomery County schools, and this happened through a grant funding. And so after the funding ran out, we had to figure out, so how do we move forward? How do we make this work happen? How do we continue this? Because we were having success based on the outcomes of those services in those 3 schools. And you can move to the next slide, please. And what that has grown into is really a great partnership between the 2 schools. And so you can see that we've actually had this partnership for a number of years. And this partnership creates an opportunity for us to discuss the many needs that our students have. NRVCS has been able to provide case managers in each of our schools. And they also provide services. So NRVCS doesn't just serve Montgomery County schools, they serve several other counties within our region: Floyd County, Giles County, Pulaski County, and the city of Radford. And so not only do they provide those services to Montgomery County, but to some surrounding school divisions as well. They have been instrumental in getting our students to the necessary appointments in terms of the case management piece, such as their psych appointments, their doctor's appointments, and any other services that the students and families might need. They've been able to provide those services. And not only that, but the case managers serve to connect us sometimes to families, because sometimes as a school division, we have not been able to be successful in reaching out to families. And so they've been able to provide us with updates or necessary information that we need so that we're working in a collaborative effort in providing wraparound services for our students. So they've also been instrumental in developing new services when a need arises, whether that's truancy, case management, as well as other additional needs. And so what does this look like within our schools? There's continued leadership from both the NRVCS and MCPS, where we meet monthly to discuss the good and the bad. We discuss the specific needs in our schools, as well as the specific needs of our students. Our NRVCS staff members attend principals meetings, they meet with counselors, and any other pertinent meetings that we may have where we're staffing the needs of our students. They're also present at our family resource team meetings. And our family resource teams is an interdisciplinary team of community agencies. This team includes court services, the Department of Social Services. It also includes other mental health agencies. And at this point, we're trying to wrap around services for students and their families, especially if that student or family is getting ready to head to court. And so we are sort of that intermediary service before the students go to court. We're assessing their needs, and then we're also determining which agencies can best provide the supports for the students and their families to meet their needs. The services, I think one of the most important things is that the services from the Community Service Board have also complemented the work of our school counselors. And we've worked really hard, especially in the last few years, to make sure that the services are collaborative, that it's a collaborative effort, and that we're offering a continuum of services where both agencies understand the needs of our students and understanding which services need to be provided. So we are using the services of our school counselors and any other supports in our schools, sometimes before we are tiering those services, and services are needed by the Community Services Board. Next slide. I'm going to try to talk about this one as much as I can. The CARES funding is really a funding that's been more instrumental through our CSB, but it's has been used to build a facility in order to divert some of our students in the ECO process, including our kids, out of emergency rooms, so as not to expose them unnecessary or take hospitals spaces and capacity with folks who could be served elsewhere. And so our next slide, please. How have things changed or since COVID-19? Well, MCPS has offered a variety of school choices. We felt like that was necessary in order to meet the needs of all of our community members. And so we offer remote learning, we offer in-person learning, and that has moved, meaning that our students participate or come to school on a half a day. And that's a half a day, 4 days a week. And so this has had some impact on the ability for NRVCS to continue the services in the manner that they did before COVID. So it's decreased their ability to see kids face to face, and the level of service, unfortunately, has decreased significantly as well. NRVCS is also having the same issue that we're having, and sometimes our remote learning has moved to our families. We're having less contact with those families. Sometimes our most difficult families are the ones that have chosen remote learning, and so we're not having the ability to have that face-to-face contact. So overall, needless to say, it's been harder to get children into services and engaging them in order to meet their needs. I think it's back on. Chris, I don't know if you've got better contact. I'll let you jump in at this point.
Can you hear me now, Judy?
Yes.
Much better. Thank you to everyone who reached out and was my IT support during that little rough time there. So I'm so sorry. And thanks for jumping in, Judy. Yeah, I think what Judy's saying is that we've had the hardest time here reaching the kids who are in the most need, given that sometimes they are all virtual or just not stepping into the school buildings. And so we're not able to really wrap our services around them. So we've noticed that on the MCPS side as well as in our VCS side. So it's really had a tough time getting to reach those hard to reach kids. Other factors are the TDT program, which has basically been decimated by the decreased school schedule, struggles that we've had with MCOs, as well as the fact that some students are, again, all virtual, and that makes it tough to have a TDT program. All right, next slide, please. So some of the things that we've seen as a result of our partnership as far as student outcomes was consistent growth with our students and their behaviors and their mental health symptoms. I think what we saw mostly is that our students that we were serving or able to serve would ask for a break and ask for their mental health provider or ask to see their school counselor instead of being disruptive in the classroom, which we know is just really hard for everybody who's in that classroom. We saw an mention that we meet at least monthly, and there a lot of times we come into that meeting, both of us, with a list of students that we'd like to discuss. Of course, a release has already been obtained, and we discuss those students right there and how we might be able to wrap services around them while they're in the school building, also while they're in the community. Our case managers who are serving the schools have weekly communication, sometimes daily, with school leadership teams to discuss students' progress. So I know a lot of times with outpatient services or services that are based out of a clinic, you might not have the ability to get in touch with the schools
being is that we are familiar with the schools, familiar with all the folks in and out of the schools almost daily, we are able to get those updates really on the fly as to how folks have been doing in their classrooms. And we've seen increased referrals to outpatient and other services. We've also began to get the pieces put into place where we can provide outpatient services within the schools in order to meet the TDT criteria that many of you are already familiar with. Next slide, please.
If I might jump in real quickly, Chris. So there are a couple of things that I'd like to point out, I think that have enhanced and strengthened this partnership and our relationship. And number one is that the relationship that NRVCS has with their parents, in addition to our relationship with parents, just really has helped to strengthen our overall relationship with our parents. I think we've built a level of trust, and families see that we are very interested in providing supports and providing that necessary supports to the families, and they tend to have a more trusting relationship, which really enhances the outcome. And then the other piece is because of the varying levels that we are willing to discuss students, whether it's at the division level where we're just staffing students, specific students, adding additional levels of support or suggestions at the school level, I think also has enhanced the relationship, but not only that, it's also enhanced the outcomes for our students.
Thank you, Judy. Some other outcomes that we've had, as you guys heard mentioned from Keith Cartwright, we have provided trauma trainings to each school in Montgomery County, as well as the surrounding counties, as well as their employees. I would say that this has been some of the most rewarding work that some of our employees have seen, because we have heard a lot of the light bulb moment. We were talking with teachers about trauma and why is Chris acting up in my classroom? And then we talked about their trauma and the trauma that they might have experienced. And then, like we said, you just see that light bulb of, oh, that is why Chris is so disruptive in my class. So we've done that. We've actually gone back to schools multiple times to provide a different level of training as well. We've provided self-care training with a trauma-informed approach. And we really do have a pretty robust trauma team here. I also know that a lot of those staffings that Judy and I have monthly lead to us kind of providing some trauma consultations. Well, we'll have one of our lead trauma folks go into schools and provide consults on how classrooms could be set up better, how they could interact with a certain student a different way, how they could set the student's day up a little bit different. And we've seen huge success from those as well. And so, in fact, a lot of times you'll see those folks in the community and they'll say, oh my gosh, you know, I'll be sitting at dinner and they'll say, let me tell you how it's going with Chris in my classroom. It's going so much better. And so it's really, again, really been really rewarding. We have partnered with the school system. We have a few folks over here at our agency who are youth mental health first aid trained. And so we partner with the school. When we were training all MCPS employees, we made sure that we had a school employee and an NRVCS employee partner to do the youth mental health first aid training together so that we could have that different approach. One of us having the mental health approach, one of us having the schooling approach. And again, found that to be very successful. We partner on trainings all of the time. You know, if the school's doing a training that they think might be beneficial to us, they call us and invite us, and we do the same. We invite them to our training, so it is not uncommon for us to have one of our conference rooms pre-COVID filled with folks from our agency as well as folks from MCPS and other school systems. So it's pretty cool, the partnership that we have been able to form that way. We've been able to have ACRA-informed services in our schools, also in our community as a result of our partnership. The Youth Resiliency Center is something that we created based off of need. I know Judy went over that earlier when I was having technical difficulties, but the Youth Resiliency Center is a daily, Monday through Friday, 9 to 2 day treatment program for kids who are not successful in the school system. So it's an all-day day treatment program where kids have mental health issues that are not allowing them to be successful in the school system. They would come back, they would come to the YRC, as we call it, the Youth Resiliency Center, participate in groups, day treatment activities, literally all day. They would get their homeschooling. I might be using that word wrong. I get homeschooling and home-based mixed up, so sorry, Judy, but they would get their, I think it might be home-based services, based out of the Youth Resiliency Center, where the school system would have a teacher come in, give them their home-based instruction there. And so they were getting that way. And we had, last I checked, we had about a 98% success rate of sending folks from the Youth Resiliency Center back into the school system. And what I mean as a success rate is they didn't have a need to come back to the YRC and were able to be maintained in their regular school system. So that was an invaluable program. Unfortunately, with COVID, that program has not got back up and running due to the group aspect that we run there. And then kind of one of the, maybe the more somber things, but one of the coolest things that we are able to do too is we provide emergency response to schools when an emergency happens in that school community. So suicides, deaths, traumatic events, fires, things like that. We will have clinicians and case managers set up at that school for the next few days, sometimes even a couple of weeks, depending on the response, set up there to respond to folks who want to discuss what's been going on and just kind of process some of the trauma that they've had. And this comes from both ways. Sometimes Judy will call me and say, hey, we had a horrible wreck and we need some help. And sometimes I'll call Judy and say, hey, I heard there was a suicide. We'll both look into it, and then we'll get some help to that school system. So that's, again, a somber thing to do, but we have been able to do that, and that seems to be very helpful. It's not just for students, it's also for teachers, counselors, administrators who seem to be struggling with that response. Anything I missed there, Judy?
Yes, I would just like to add that that's probably been one of the most successful, I think, collaborative acts that we have when we have a crisis in one of our school buildings, and being able to call in not only our school counselors, but also our counselors from NRVCS to provide the supports and to be available. I mean, it's just been a really robust service that we've been able to provide for our students as well as our staff members. And I think that that's always been received well and welcomed in our schools. And I'd like to just add one more community involvement that I think has also been really nice to see happening. Just recently, like within the last year, there has been a community coalition on trauma in Montgomery County. And it's been great that they have asked MCPS to be a partner in that effort. And it's also been great because we already have some background knowledge around how we're informing trauma within our school division. And we're now pushing and moving that at the community level as well.
Thanks, Judy. I see a question over here of what is ACRA. I'm so sorry that I didn't spell that out. ACRA is the Adolescent Community Reinforcement Approach. It's a approach that is geared towards substance use. Next slide, please. So this next slide obviously is just Judy and I's contact information. If you have any questions, comments about the work that we're doing here in the New River Valley or in Montgomery County schools, then please feel free to shoot us an email or look us up and give us a call. I think that's all we have,
Chris
Joe.
and Judy. Thanks so much. We appreciate your presentation, working through all the glitches there, Chris. Thanks. Great information, and thank you again for being here. You know, if you start to think about, you know, how you're starting these partnerships, right? And you get that partnership together, you're going to find ways to be able to make sure that you can work together, and that'll come through. So thank you for that, and thank you that you're looking forward and into the future and how to adapt to what's happening right now. Great stuff. And as I feared, we're going to be running short on time. Great information. I think we've got about less than a half hour left, and we want to get to Newport News Public Schools and their partner Hampton-Newport News Community Services Board, and we want to leave a few minutes for some questions as well. Next slide, please. So thank you, Linda, Erica, Lisa, for being a part of this. And I'm going to hand it over to you for your presentation.
Hello, thank you for having us. I'm Erica Daniel, Student Advancement Coordinator, School Psychologist for Newport News, and with me is Linda Askew as well as Lisa Hogg, and you'll be meeting them here in just a moment, so you can go ahead to the next slide. Just to kind of describe Newport News Public Schools as far as the type of population that we have, we're a fairly large district. We have over 28,000 students in 42 different schools. So we have had to find ourselves kind of figuring out how to navigate supporting students across the district. We have a very diverse population. So the goal of Newport News is really to make sure that we combine as much supports and services to develop our students in a very positive way. So we really worked collaboratively, both with the community, but within our district as well, to mobilize resources around the school and the community to not only meet educational needs, but also to help mental health services as well. Through Newport News and through our collaboration with CSB, we provide intervention, consultation, and counseling for students who are experiencing significant difficulties that we obviously know also impact their educational experiences. You can go ahead and move to the next slide. So our main mission is that we ensure that all students graduate college, career, and citizen ready. And that sounds very generic in a lot of ways, but it actually, when you start to think about it, to be college, career, or citizen ready, there's a lot that goes into it, and mental health is a big piece of that. So we want to make sure that we're successful when we offer mental health services and opportunities, that we want to make sure that they are able to develop in that positive way. And our student advancement department incorporates a diverse group of professionals, including our special education department, our school psychologists, school social workers, student support specialists, as well as our talented and gifted as well. Go ahead to the next slide. So this, though it's hard for you to see, and I'm happy to share it out at a later time, but we really needed to look at that multi-tiered system of support, or as Maribel referenced as well, looking at our Virginia tiered system of support. When we are making sure that we're providing the mental health services, we need to make sure that we have all levels of services in place. So we really make sure at that tier 1 level, I think Montgomery spoke to it as well as VDOE has spoke to it, that we really look at the social emotional learning, but also the mental health awareness for our staff and students, so that there's some general knowledge as to when we know there are students that may be experiencing concerns. So we do have social emotional learning curriculum within our district that we piloted last year, and we now are expanding to all elementary schools, as well as implementing SEL at our secondary. When we move into tier 2 and tier 3, that's really when our collaboration with CSB comes into play. But CSB is also involved in that tier 1 as far as providing a lot of that awareness training. And Linda and Lisa will be getting into that as well. So I'll go ahead and send it over to Linda to take us further.
Thank you. Good morning. My name again is Linda Askew, and I'm the supervisor for student support and mental health services with Newport News Public Schools. If you could advance to the next slide, please. Our partnership with CSB began in 1979, if you can believe it or not. It was a partnership that was developed to create what is now known as the Student Support Program, which is the program that I currently supervise. But in 1979, it was called the Student Assistance Program. And that program was developed to provide support to our students in regards to substance abuse and mental health, right here within the school setting. So instead of the families having to go out and find those resources in the community, we access those services for families in the school setting. Also in 1979, Newport News and CSB partnered to make sure that families could receive mental health support services, not just through the Student Assistance Program, but also at the campus of CSB in Hampton back in 1979 for their mental health services, whether it be outpatient therapy, medication management, or substance abuse treatment. Then we evolved all the way to 2007 where we partnered with CSB and Newport News Juvenile and Domestic Relations Court to develop the Juvenile Drug Treatment Court Program. We knew, unfortunately, that some of our students were experimenting with drugs, and through their drug usage, they needed more support than we could provide within the school setting. So that partnership was established to provide treatment services for youth in Newport News. In 2008, we moved on to therapeutic day treatment services, where we had behavioral health counselors from CSB coming right into our schools to provide support to students on the spot whenever those needs arise. They worked collaboratively with our principals, with our school counselors, our student support specialists, social workers, psychologists, and teachers to ensure that students had everything that they needed to not only be academically successful, but to also work to improve some behaviors that they may have found difficult and impeding their success within our schools. And most recently, in 2019, CSB and Newport News, we're on that journey for mental health, established the ability for 2 of the CSB outpatient therapists to actually come into our schools. They have offices set up in 2 of our school sites to provide mental health therapy services to our students and our families that might need that care. It has also helped them to not have to always go to CSB to access those services. It was mainly set up so that families who needed a place to go and didn't have transportation to CSB could actually receive those services on site, because of course their kids are right there within Newport News Public Schools. We transport kids to school during that time. I know right now it's a little different because we're in the virtual learning setting, but during that time in 2019, it made it easier for kids and families to access outpatient therapy services. Next slide, please. Also, with our partnership with Newport News Public Schools and CSB, we're always working together to make sure that both sides of the house know what's going on with our families. So with COVID-19, we've established a partnership that if we need to call upon CSB for support, even in getting clarification on how families can access services with CSB, they're always available. We can contact Lisa directly, or we can contact members of her staff directly, just to make sure that if we have to make a referral for students and families to receive support from CSB, we know what avenue to explore for that referral. Also, if we have a need for students to receive services outside of academia, we can call on our CSB partner to make a referral for case management, for instance, because we also have a partnership with Newport News Department of Human Services, who provides our family assessment and planning team. And with the referral to CSB, that has allowed some of our students to have access to Comprehensive Services Act funds in order to have services in the community. For example, a service that we might not necessarily provide, but CSA funds can provide, is mentoring. So if a student needs additional support, we reach out to the Community Services Board and we make a referral for case management services. And then in turn, CSB will then make a presentation to the FAP team to ask for funding for mentoring. We also have had several community events that promote health, education, and wellness. And some of those events are established by Newport News Public Schools, and some of them are established by our students that attend Newport News Public Schools. Every time we've reached out to CSB and said, hey, do you mind being a vendor, or do you mind setting up a booth to just give information to our families about the services that you provide? They've always said yes, they've always shown up, and they've always provided that education for our families. We also have meetings between CSB and our student advancement team. That team is comprised of our executive director, Dr. Mitchell, myself, Erica Daniel, and Richard Dermeyer. So we make sure that everything that's going on the school side of the house and the Community Services Board side of the house is known between both sites, so that we can make sure that we ensure the best possible service provision for our kids. Next slide, please. Also, with our partnership with CSB, we've made sure that we've gotten our mental health training needs met. Lisa has always established an open door policy when it comes to mental health first aid for youth. And if we have any new staff members coming on board that haven't been trained in mental health first aid for youth, they will set up a class on the spot. At this point in time, we are doing those classes virtually just to ensure that all staff members are trained. They also provide training in trauma. Next slide, please. And we also had here in Newport News Public Schools have a team of individuals that are considered to be our graduation specialists. They work with students on the high school level just to ensure that they have everything they need to graduate successfully from Newport News Public Schools. There are times when there are needs outside of the academic area that we have to call upon CSB to come in and meet with us and meet with our students to ensure that they get those wraparound services that so many of us have talked about earlier today. Next slide, please. Also, just to let you all know, we attend joint trainings together. Most recently, we are involved, and we being Newport News Public Schools support staff, which is social workers, psychologists, our licensed mental health therapists, and student support specialists. We're involved in a self-care series. It's a 3-part series, but our executive director reached out to Lisa and invited CSB staff to participate in those trainings as well. So we continue to work collaboratively just to make sure that our student needs are met, but also needs of employees as well as CSB employees are met all at the same time. And with that, I'm going to pass the baton to Lisa, and I thank you all for listening.
Good morning.
Good morning.
My name is Lisa Hogg, and I am the Youth and Family Director here at the CSB. And I think I'm as excited as Chris and Judy to work with our school system and our community partners. So it's been a real privilege to hear what they had to say. And it's interesting that while we're in different geographic areas, we're doing so many of the same things. Could we go to the next slide, please? Okay, so pictured is a display of our full continuum of supports and services for children. And our services at Hampton-Newport News, they range from your prevention and early intervention services to very intensive crisis intervention supports. And during these challenging times, we make it our highest priority to make it easy to access services. So most families, they can enter really through any door by calling any of our sites, but a primary way to enter is through our rapid access portal or through our large case management department. And our school partners, they know how to get us and they know when to reach out to us. And so when they reach out to us, we very quickly work together to identify the right services. So what's important is for us to plan together to ensure that during these really, really challenging times, if we have an opportunity that we get folks linked up, and I mean the child and their family member to our services. And a strength of our system is that we do have 2 board certified psychiatrists, 2 boarded in child psychiatry, and then we also have 5 residents available. So we are able to offer immediate access to these community-based services. And like other CSBs, our focus is on maintaining children in their community and in their family home. And so we're able to kind of package these services to stabilize children in partnership with our schools. Next slide, please. So with our, as you can see on this slide, it gives you an idea of some of the curriculums we implement. And what we've done is strategically place staff at our court services unit, because as Linda mentioned earlier, sometimes when children touch the juvenile justice system, there are, that's an opportunity for us to offer very specialized support. And we do so through evidence-based curriculums that are offered both at our court services unit, but also in juvenile detention if a young person does, if the result is that they are in detention. We also work with them in post-dispositional settings. And we do everything we can do that, you know, to really engage a young person when they're in that kind of, shall we say, juvenile justice crisis. And so we have a dedicated team of juvenile justice staff who are, like I said, based out of our partners' offices, and we work closely between the schools and our juvenile justice system. We have offered assist, and we'll continue to do so. As recently as this week, we offered a small virtual mental health first aid training, and we know that's very, very important for all of staff and for us as service providers. We let's see. One of our other partnerships, our partnership with the city, as Linda mentioned, we are VAP representatives. We work closely with our CSA stakeholder partners, but we also have and have had a 15-year partnership with our Human Services Department to implement Healthy Families. And in the past, we've implemented the Healthy Families or Healthy Start curriculum, but more recently, we've shifted over to the Parents as Teachers curriculum, which offers us more flexibility to serve families with lots of children in the household. So we're not limited to a first child or to a first birth. We're serving, gosh, over 100 families right now in Newport News, and we're very, very focused on school readiness and helping with very basic things like school attendance, working on issues of truancy with families, and just removing any barriers to accessing education. Okay, next slide, please. Okay. So as a CSB, I think Nina did a great job of explaining all the different things that are offered to CSBs through the department, and we do receive some block grant funding for our prevention services. And so we implement prevention services broadly across the school system. And we do offer, as Linda talked about, the outpatient in the 2 schools, and we really want to build on that, and we'll talk about that later in the presentation. But during COVID, it's really given us as a team, and I mean a larger community team, but particularly as a team between the schools and the CSB, it's given us an opportunity to really examine all of our practices and to really fine-tune every process so that during this COVID emergency period, we don't miss any opportunities, because we're not able to see the students in the buildings as we have had the luxury of doing in the past. And so we really are kind of tailoring everything we do in terms of response time and fine-tuning our telehealth processes so that we don't miss opportunities or create any additional burden to families that are already struggling with this adjustment to learning from home. Next slide, please. Okay. So I think we benefit so greatly as a community when we work together. We are as a CSB, I think we're so fortunate to have had this historical relationship with Newport News. I know the director that I worked for originally was the person, Chuck Hall, who started all of these, had of these great ideas back in 1979. And while he would take no credit, I think we've really tried to bring some of his dreams to life. And as a locality, like I said, we're fortunate to have such an incredible school system. As a region, we really, I think Region 5, Nina talked about the regions, we have a very innovative system and just a really creative array of services. And so one of the things that benefits Newport News is we have a regional urgent care center that's based on the CSB campus. Right now, all of the services and supports through that program are offered virtually, but we do have the ability to see folks in person if that's what they need. And at this point, those who are seen in person are those at the highest level of need and typically in crisis. So we're of the CSBs, we are one of the largest, or the second largest. And some of the things that are happening statewide, Nina mentioned the mobile crisis initiatives, same-day access, and primary care screenings. Those are all initiatives that just that really benefit the kids in Newport News, because all of the additional screenings and supports help us really look at the child, not just from a behavioral health standpoint, but from a physical health standpoint, and the connection between their behavioral health and physical health. And so it just strengthens our opportunity to work with the school nurses, to work with the school counselors. And so, we're really working systemically to address the overall health of a child. And so one of the other things we're doing together is just continuing as a system to work on our continuity of operations planning, which is an ongoing process. And, this has been such a challenging time for everyone. Just having the opportunity to do wellness trainings together, just communicating, it just helps us to, plan better together. And so it's a very exciting opportunity to work with Newport News. Next slide, please. So one of the things that we're doing in Newport News is we're building on, we're a trauma-informed community, and we've been chartered as such. That happened last year. We received a technical assistance grant for trauma-informed care about 3 years ago. And so we're continuing, to really broaden the community, the broader community's understanding of trauma and using the ACE to really identify, and we try not to re-traumatize. And so we've of course been rehearsing every process through our COVID experiences. And so we really are, I think we really are being diligent and kind of re-examining every process. And again, we are focused on staff wellness. And so our plans to develop trauma resiliency curriculums, that those are both for staff and for students. But we've, as a community, taken very seriously the need to support our staff, because so many of them are juggling so many things. And we're just, we're committed as a community to increasing the number of schools with on-site therapy services, because as we know, when the schools reopen, the students who are in school, there will be a need for folks to be in person and available. And so we want to partner and make that critical service available. And we will continue to make services immediately available and just be as adaptive as we can, because our goal is not just to serve the young people, but to really help stabilize the entire family system. Because as a community, we found that that we're most successful when we wrap support around the entire family. And by working together, we learn enough about both the student and their family to really support the family system. And so it begins with our superintendent, our executive director here at the CSB, but we're very, very committed systemically to identifying and implementing the right services to ensure that families can remain in the community, and they can be prepared to be educated, and they can be successful. And all of the goals for readiness of Newport News public schools that were discussed earlier. We want young people to be independent, community ready, college ready, career ready. And so everything we're doing is to embrace, we try to embrace those missions. And I think we're just really fortunate to get to work together. And I wish we had more time today for the opportunity to be a part of this really important presentation.
Well, great. Thank you so much, Lisa, Linda, Erica. We appreciate that so much. Wow, a 40-year partnership that continues to grow. Very powerful and great stuff. And you said it well, Lisa, when you mentioned, we have two very different division partners here, Montgomery County, kind of more rural, and then Newport News, yet you're doing a lot of the same things. And I think that speaks again to the opportunities that people have in this time to be able to pull together everything they have and to be able to learn from the things that you've just mentioned. So thank you so much for that. And Martha, I think we're going to go to the second to last slide. We're not going to be able to do the question and answer. I just want to value everyone's time. But what we will do with these questions that are coming on right now, as well as the questions that you're sending through chat. And sorry, I think earlier at the beginning of this webinar, I said you couldn't do that through chat, but obviously you can. So we will compile those. We're going to get back to you with the questions that we just passed over in the slideshow, as well as the questions you have in your chat. And we will work with our presentation partners to be able to get those answers, and we'll send them out to the whole group as well as the PowerPoint. So that's what we'll follow up on. But I want to, given what you've learned now, as we just wrap this up, where are you really with your relationship? CSB, LEA, where are you with your relationships? You've heard a couple say that, unfortunately, the tragedy of Virginia Tech was kind of the impetus of getting a partnership started. what is that need in your division? What can you identify right now as a start to say, hey, we need to extend this branch out and we need to get as much together? I mean, we're in a pandemic, that's a thing, but what else? Are you looking at your data and be able to figure out what that looks like? And then how will that partnership benefit your students and your families? You may not exactly know that yet, but get together, make that first call. Do you know who to contact? And really, let me just throw this out really quick to our partner presenters. Who did you contact? If I can ask that really in the last couple of questions. When you first reached out, is this reach out more of a kind of, hey, superintendent level? Was it a director, the division director? Was it a school level? Was it somebody at a meeting? And I'll start with you, Linda. I can see you shaking your head, and Erica. How was that first contact made? It was 40 years ago, but now too, you know?
In 1979, it was between Chuck Hall and the Director of Student Services. But currently with our partnership, CSB has held several meetings for our superintendent, Dr. Parker. And through those meetings, he is the one who envisioned allowing students easier access to services, because not everyone can go to the campus of Community Services Board to receive those services that they may need to ensure they get proper mental health care. And so we just developed it from there. He said, he put the charge out there. We need to make services easily accessible to our students and their families. What can we do? So with that charge, it went to Dr. Mitchell, our executive director. And from there, we developed a team which comprised of myself, Erica, Daniel, and Richard Durmeyer, to find out how we could get those services started. We reached out to the CSB. At the time, we worked with Nicole Jackson as well as Lisa Hogg to establish those services. But our partnership over the years has been a very easy relationship. So whenever one of us or any of us come up with an idea to make things happy or relatable for families, we just get it done. So for your question.
Yeah, and I was just going to add, I mean, it's obviously we've had a 40-year history, but I think in the last handful of years, it's become more public as far as people are more aware of all the mental health services that we have available through the school and through our partnership. And that's a special thanks to the leadership in our school.
Great, thanks, Erica. Judy and Chris, quick.
Again, so far apart, but a lot of similarities in our story as well. Obviously, we had the funding from the grant related to the Virginia Tech tragedy. And then once we had those 3 people in schools, we had everybody calling, literally all the other schools. We want one of those. We want some of that. We want to do exactly what they're doing. And so they would call the school board. They'd call our director here at the CSB. And from there, it was a whole lot of lunches at the Mexican restaurant, figuring out on paper, how can we make this work? And it's grown to be so much more than we ever thought it would, just based on those 3 folks. So a lot of similarities, same thing. And same thing, when a need arises, we contact each other and get it done, just like Newport News said.
Thank you so much. Oh, go ahead, Judy.
Although the leadership has changed, like I wasn't on board when this first started here in Montgomery County. We just know that the need is it's essential to us to meet the needs. And we see that it works. So irregardless of who is in position, we have found it to be sustainable just by the mere fact that the need needs to be met.
Yeah, thank you. And I mean, with students and families as our target to be able to assist, you know, it becomes something that's a necessity, and you work it no matter how to get it done. So thanks again to everybody. What we'd like to do, DBHDS and Virginia Department of Education would like to do this again in the spring. What we'd like to do then is to be able to hear from you. Those of you who are maybe going to enhance and start doing some things with your CSB, we'd love to have you as the presenter participants next time. So we will be in touch. We have your emails. We will be in touch with you. We will answer your questions, first of all, and then we'd like to hear your successes the next time we do this in the spring. We will stay in touch. Again, thank you, Lisa, Erica, Linda, Judy, Keith, Nina, Chris, Martha, Sarah, Catherine, everyone that had anything to do with this. We appreciate it. Maribel had to jump off. Take care of those kids, love on those children. Let's do great work, and we will see you soon. Thanks, everyone.
Thank you.